Hello everyone, and welcome to our presentation, Child Welfare in the 21st Century, the Need for a Pre- and Post-Permanent Service Continuum. Today's presentation is scheduled for approximately 90 minutes. To eliminate background noise during the presentation, your phone lines will remain muted for the duration of our presentation. There will be opportunity to ask questions or provide comments during the Q&A portion of our presentation, and you may join the conversation by calling our toll-free number 1-866-325-7968. When prompted, enter passcode 206-80753. You may also submit questions or comments by typing in the chat window, which is located at the left of your screen. When finished typing, click on the send button to submit your questions and comments. When not actively participating, we ask that you place your phone on mute by pressing *6. And *6 can also be used to unmute your line when you're ready to speak. Please remember to avoid putting your phone line on hold so we can avoid any hold music or other interruptions during our meeting. Today's PowerPoint handouts were included as a downloadable handout with your webinar reminder email. If you have trouble accessing the handout, please email me at iparks@spalding.org to receive a copy of the handout after the conclusion of our presentation. Our presentation will also be recorded and later archived on our website, www.QIC-AG.org. We will send you email notifications when the recording is available. I'd now like to introduce our presenters for today. Melinda List, who is our project director for the QIC-AG, has over 20 years of experience in child welfare in both the private and public sector. Ms. List is the former director of the National Resource Center for Adoption, where she led efforts on developing a post-permanence model for states, including convening 2 national think tanks to discuss innovative practices taking place throughout the nation. Prior to her work at the center, Ms. List worked on national court improvement programs, helped implement a statewide research project on post-adoption services, and assisted with the redesign of specialized foster care program in Illinois. Ms. List was a licensed foster parent and has since adopted 2 children. Nancy Rolock is an assistant professor at the Helen Bader School of Social Welfare, University of Wisconsin-Milwaukee. She has conducted child welfare research since 1996 with a focus on stability, permanence, and post-permanence research. Dr. Rolock is committed to building evidence for what works and what does not in child welfare. Through her research, she tries to bridge the gap between research and practice so that children and families are provided the best services available. She is currently an evaluator for the QIC-AG and an evaluator for a project aimed at recruiting and training families interested in adopting children who have been in foster care the longest in Milwaukee. Finally, we have John Johnson, who currently serves as the Director of Foster Care and Adoption Services for the Tennessee Department of Children's Services. John has been involved with child welfare for over 18 years in several different capacities, including congregate care, direct case management, supervision, training, and other unique projects related to children in the child welfare system. John's current responsibilities include providing TA to local staff regarding policy and practice and management of the foster care, guardianship, and adoption assistance subsidy programs. John is also very active with the National Association of State Adoption Programs, NASAP, where he currently serves in the role as president. We will also be joined by June Dorn, National Adoption Specialist with the Children's Bureau and Federal Project Officer of the QIC-AG. I'd now like to introduce Melinda List, who will begin our presentation.
Good afternoon. I'm glad that all of you have joined us for the first Lessons Learned webinar with the QIC-AG. Before we get into the main focus of the webinar, I want to provide a brief overview of the National Quality Improvement Center for Adoption and Guardianship Support and Preservation, which will help to lay a foundation for the rest of the webinar today. The QIC-AG is funded through a 5-year cooperative agreement with the Children's Bureau. We're just ending our first year. In fact, tomorrow is the beginning of year 2 for this 5-year initiative. Spalding is the lead agency for the QIC-AG, and listed on this slide are all the partners which are part of the QIC-AG leadership team. And today, of course, presenting with me is Dr. Nancy Rolock from the University of Wisconsin-Milwaukee. As Ingrid mentioned, June Dorn is joining us today, and I'd like to give her just a minute to greet everyone and say a few things about this initiative. June?
Thank you, Melinda. And I do want to extend a welcome to everyone joining the webinar today. Thank you so much for taking time to spend a bit of your afternoon with us. This initiative is very important to the Children's Bureau in our efforts to develop and build capacity in the states around adoption and post-adoption services. And the Quality Improvement Center has had a very productive first year. And we are very excited about the work commencing in their pilot sites. And we hope that all states will reap the benefits of what is learned about how to assure stable adoptions through the efforts of this project. So thank you again. I'm sure this will be a very rich period of time for you. And Melinda, thank you. Hand it back to you.
Okay. Listed on the slide is the goal as it appears in the funding opportunity announcement for this initiative. I usually like to break the goal into 3 smaller goals. The first one and most important is that to develop evidence-based models of support and intervention for our 2 target populations. And the next slide I get to, I will discuss what those 2 target populations are. The second part of the goal is to build capacity across the entire continuum for our partner sites in regards to adoption and guardianship. And lastly is replication. We won't have time to replicate during this 5-year initiative, but it is a long-term goal that models tested with the partner sites could then be replicated across the nation. As I mentioned, there are 2 target groups with this initiative. Target group 1 are children who are not moving to permanence. They may or may not have an identified permanent caregiver, and children that fall in this category likely have more challenging mental health, behavioral, and emotional issues. I often refer to these children as the ones that are way late in the system after much effort has been put forth to try to achieve permanence for them. Target group 2 are all children who have achieved permanence through guardianship and adoption, and it's important to note that this does include international as well as domestic private adoption. This next slide shows the theory of change, which really lays the foundation for the QIC-AG work. And I'll briefly go through each of these. The first one are that services need to be provided early. We want to ensure that we are proactive in our outreach to families and that the preparation and engagement starts long before finalization. Secondly, we want to identify families most at risk. Our systems need to become more sophisticated in identifying those children and families who have higher risk factors for discontinuity, and then targeting services to meet the needs of those children and families before they might manifest behaviors. And lastly, services should be evidence supported. We need to ensure that the interventions we put in place are effective in achieving the outcomes that we intend. The selection of partner sites was a competitive process. There were many sites that were great candidates for this project, but we ultimately had to narrow it down to 8 sites, which are listed on this slide. So over the next 4 years now, we'll be collaborating with Catawba County, North Carolina, the state of Illinois, the state of New Jersey, the state of Tennessee, the state of Texas, the state of Vermont, the Winnebago tribe of Nebraska, and Wisconsin. I'm now going to hand it over to Nancy, who's going to walk us through child welfare in the 21st century. Nancy?
Good afternoon. Thanks, Melinda. The QIC-AG, or as we call it, the QIC-AG, is responding to a major transformation of the U.S. public child welfare system. We characterize this evolution from a 20th century foster care system focused on the welfare of children in state custody to a 21st century post-permanency system focused on the well-being of children in publicly assisted, safe and stable homes with birth families, adoptive parents, legal guardians. This slide shows the number of children in 4E subsidized foster care between 1984 and 2013. I think this is a slide that many are probably familiar with. What may be less known is that during the same time frame, the number of children in 4E subsidized adoptive and guardianship placements grew from about 12,000 in 1984 to almost 450,000 in 2013. Clearly, this was influenced by ASFA, Fostering Connections, and other federal and state level initiatives. Taken together, this chart shows that there are approximately 3.5 children in federally assisted adoptive and guardianship homes for each child in foster care. With these changes, it is now possible to imagine reconfiguring federal and state child welfare policy to address the trauma of child maltreatment and its adverse effects on the future health and well-being of the children involved in these systems. Before we go any further, let me tell you where I'm headed. First, I'm going to summarize what we know through research about the post-permanency population, and then I'm going to provide some food for thought about what our next steps should be. So with the increase in the number of children exiting foster care through adoption or guardianship, while this increase was met with lots of accolades and awards to state, it also brought some caution. There was concern that there was a push towards adoption and fear that this would be a revolving door, that many of these children would just end up coming back into foster care. There was also concern that these families were not well prepared or equipped to meet the needs of the children in their care, that issues of unresolved trauma could be too much for some families. A brief from the Child Welfare Information Gateway in 2012 summarized the state of knowledge well. They called for additional research to understand really just basic information, like the number of children who experience dissolution after an adoption, the risk and protective factors associated with dissolution and disruptions. They also called for uniform definitions. I'm going to start with some definitions so that we're all on the same page as I present the information on post-permanency research. So common terms include displacement, when a child is no longer in the physical custody, but guardianship and parental rights remain intact. Post-adoption placement, that's when a child re-enters state custody to receive necessary services. Dissolution, which is when an adoption or guardianship is legally terminated for reasons other than parent death or incapacitation. And then finally, subsidy ending. And this is when an adoption or subsidy is ended prior to the child reaching the age of 18. So I'm going to use the term post-permanency discontinuity to cover all of these occurrences. While each type may require a different solution, I think we need to understand the issue in its broadest form. Post-permanency discontinuity, however, is distinct and different from disruption. So a disruption is when a child is removed from a prospective adoptive home or guardianship home prior to finalization. Some of the research on post-permanency discontinuity is summarized in this slide. Basically, we see that between 1 and 10% of adoptions end after they've been finalized. In New York, for instance, 4 years after adoption, 3% re-entered care. In Kansas, 18 to 24 months after adoption, 3% were not living in the adoptive parent's home. But we also see is that the adoptive parents in New York expected that the child would return home. In Illinois, 85% of families said that they were able to meet the needs of the children on their own without additional assistance. Yet for those in Illinois who needed additional services, these families often expressed this deep frustration and reported that the adoption had a negative impact on their family functioning. While this summarizes much of what is known about the post-permanency population, many of these studies were conducted with relatively small groups of children and families. They had relatively short follow-up periods. Part of the reason for these issues is that it's often difficult to track children, particularly after an adoption. In many states, when a child is adopted, their names change, sometimes their social security numbers change. The child welfare ID often changes from a foster care ID to an adoption ID, making it difficult to track children after legal permanence has been achieved. In addition, some families just might not welcome post-permanency outreach by the child welfare system. This slide reports on some work I've done in Illinois where I've been able to track the post-adoption and post-guardianship outcomes for about 2 decades. What this slide shows is if you look at that little graph, in 2000, that green line shows that all of the kids that exited to adoption in 2000, 2 years later, about 2% of them experienced discontinuity. At 5 years, it was about 6%, and at 10 years, it was about 12%. So I bring this up because I think it makes the point that it takes time for discontinuity to occur. And a lot of those studies that I just cited only were able to track kids for 2 or 3 years post-finalization. So I think we need to be looking more long-term to really understand discontinuity. The National Survey of Adoptive Parents surveyed parents who had adopted through the child welfare system, international adoptions, private domestic adoptions, a comprehensive survey. And here I want to just point out that what they said is that most adoptive parents reported the children were doing well and reported satisfaction with the adoption. So some good news to share. Another study from Illinois is over 21,000 children. They were tracked for at least 10 years or through the age of majority. What we found here was about 13% experienced discontinuity. And here we want to just explain a little bit more about what kind of discontinuity was experienced by the children. So first of all, I'll point out that 87% did not experience discontinuity, as we were able to track through Child Welfare Administrative data. The 13% that did, those most common types of discontinuity were this intensive service. So that blue column, about 21% of children who experienced discontinuity came back into foster care and were in group homes or residential treatment, that kind of thing. Another 25% came back into foster care and were in traditional or kinship care. And then 40% had a subsidy end. So this is, for instance, a child who is 10 years old and for some reason their subsidy ends. There's no record of why in data, but all we know is that the subsidy has ended. A couple of case examples just to kind of explain what I'm talking about in a little bit more detail. So those intensive services, here's an example of Rosa. Rosa was adopted by non-relatives at 4. She stayed with them for 11 years. However, at 15, she re-entered state custody. And she lived in institutions, group homes, detention over the next 4 years. And at the end of the study was still in state custody. Another example of the traditional or kinship placements was Hannah, who was adopted by relatives at age 6. She stayed with those relatives for 11 years. And then at 17, she re-entered state custody, where she lived primarily with kinship foster parents, but also had some detention spells. And she ended up emancipating from care. Finally, I'm going to talk about another study that I'd like to highlight. Here is a study where we interviewed 346 adoptive parents and guardians, and then we were able to follow their experiences through child welfare administrative data through 2012, so for 6 additional years. And here, just some of our key findings is one, we found, not surprisingly, but we found that children with behavioral problems, whose parents said that they had behavioral problems, were more likely to experience discontinuity. This was confirming other research that had been done. But what was more interesting for us was one of the questions we asked the parents and guardians was, have you ever thought of ending this adoption or guardianship? They could say never, all the way down to frequently. And this next slide shows that, so in research terms, the caregiver commitment, or the response to that question of have you ever thought of ending, mediated the relationship between child behavior problems and post-permanency discontinuity. So what does that mean in lay terms? What that means is that there were caregivers who assessed their children as having behavior problems, but never thought of ending the adoption or guardianship, and the child remained with them. But there were others who assessed their children as having behavior problems. They were more likely to express thoughts of ending adoption or guardianship, which in turn significantly elevated the likelihood of post-permanency discontinuity. So for me and for our project, I think what this means is that if we do something as simple as asking caregivers how they feel about the adoption or guardianship after permanence, that these questions can help us understand the level of commitment, and that we might be able to identify those families who are at greatest risk of post-permanency discontinuity, reach out to them in advance of a crisis to provide support and services that we hope will prevent discontinuity. I know that was a lot of research, and so let me just kind of summarize some of the key findings, the key take-home messages from this. Number one, I think it's important to acknowledge that most of the families report that they're doing fine. But there is this subset of families who tell us that they're really struggling, and we need to really figure out who those struggling families are and target services to those families in a preventative manner. We think that kind of asking some of these questions after permanence can help us identify those families. It's also important to acknowledge that it takes time for discontinuity to occur. It doesn't occur right away, right after finalization, and that we really need better mechanisms for tracking and understanding what happens post-adoption and post-guardianship. Now I'm going to shift the focus of this presentation to thinking about an unsettled question that has driven major policy debates in child welfare for over a century. Where should the primary locus of responsibility rest for the safety, family permanence, social and emotional well-being of children who have been neglected or abused? And for our work with the QIC-AG, what role should government play in the lives of families, particularly after legal permanence has been achieved? This is a question regarding the scope of public interest. Should public child welfare be satisfied with a focus that is primarily the safe reduction in the number of children entering foster care, represented at the top of that slide? Or should set its sight on a diffuse or broad range of child well-being improvements, such as fostering secure parent-child attachments, intervening when child development lags behind normative milestones. Prevention efforts focus on decreasing the risk of post-permanency discontinuity for children who have left foster care, represented at the bottom of this slide. The answer to these questions span a range of possibilities, from what the economist Thomas Sowell has called the constrained vision, that at the top, which would limit government's child welfare role only to the protection of children's safety, and the bottom, the unconstrained vision that would expand government's role to include all that can be done to improve the health, family permanence, education, social and emotional well-being of all children. So the Gallup poll has been asking a representative sample of American adults a generic version of this question since 2010. Where would you rate yourself on a scale of 1 to 5, where 1 means you think the government should do only those things necessary to provide the most basic government functions, that constrained vision, and 5 means you think the government should take an active step in every area it can to try to improve the lives of its citizens, the unconstrained vision. In September 2010, public opinion split evenly between 1/3 of Americans who tilted towards spending only on the most basic government functions, and another third who leaned in favor of spending in every area government can to improve the lives of people, and a middle third who fell somewhere in between. In 2010, just prior to the midterm election, public opinion tilted slightly in the direction of the constrained vision, at 35%, and away from the unconstrained vision. You see 32% at the bottom of the slide. Even though this was a small change, the consolidation of Republican control of Congress was consistent with a shift in voter preference towards more limited government. The direction of this shift is particularly noteworthy because the federal government's role in solving the nation's problems, as Gallup noted, has arguably been more salient in recent years during the housing crisis, the economic crisis, and the passage of the Affordable Care Act. In addition, U.S. politics has been experiencing a splitting of the American electorate into opposing ideological camps. This splitting has resulted in a gridlock that characterizes not only child welfare policy, but public policy in general, and has transformed what were once tame problems into the wicked problems of child welfare. Wicked problems is a term akin to tricky, coined in the political sciences. It describes problems that defy ordinary solutions. Mandatory child vaccinations, global climate change, even universal health care. These are prime examples. Child welfare has become a problem that defies ordinary solutions, not necessarily because the problems are inherently difficult, although some definitely are, but because there's no widely agreed upon moral rule for taming such problems. Solutions that were once deemed easy, such as locked facilities to control ungovernable juveniles and relative responsibility laws to enforce family support duties, have been abandoned, not because they didn't work, but because public acceptance of the ethical merits of these practices weakened, and common moral ground receded as public opinion became polarized. Each camp perceives its own policy prescription as morally correct, but policy disputes can't really be resolved simply appealing to the superiority of one's moral motive over another, but must be settled by other means, including scientific tests of which policies produce the superior outcomes with respect to child safety, family permanence, and well-being. We see this pulling apart happening in child welfare, where there's disagreement over the degree to which family preservation should be emphasized over child removal, in spite of ASFA. Kinship preference over licensed foster care, in spite of the Personal Responsibility and Work Opportunity Act, and same-race adoption over prohibitions against racial matching in spite of IEPA. So by now you're probably wondering, where's Nancy going on this long road? The takeaway message is that the policy environment within which the QIC-AG will be operating over the next 4 years will likely be impacted by the gridlock of divided government. The gridlock is affecting the policy environments not only at the federal level, but also in each of our sites. The gridlock is unlikely to be broken by which party is able to cut taxes the most or increase spending the most. A new consensus is emerging across ideological lines, which holds that policy answers must come from an evidence-based perspective on wicked problems, one that acknowledges the incompleteness of any solution that prioritizes a single moral motive, and the ethical necessity of grounding direct practice and public policy in solid scientific evidence of what works to improve child safety, permanence, and well-being. It's astonishing how quickly a bipartisan consensus on evidence-based policymaking has emerged. Here are 4 examples. Most of these proposals call for the building of evidence through systematic implementation and rigorous evaluation, and they come from a variety of ideological perspectives. In the current fiscal environment, implementing the wicked problems perspective involves shifting resources from programs where the evidence is weak and reinvesting them in programs where the evidence is strong. In order to bring evidence-based policymaking to child welfare, the Children's Bureau convened a committee of national experts to assemble a framework for building evidence in child welfare and scaling up programs that worked. The framework is a process for developing child welfare interventions, building evidence about their effectiveness, integrating effective interventions into practice, and continuously improving on service delivery. The outer ring of the framework is the identify and explore phase, and this is where the QIC-AG sites are currently working. The purpose here is to identify the problem and target population, construct a theory of change, and identify possible solutions to the problem. The end result is a selection of an intervention based on a well-reasoned understanding of the problem. After the sites have selected an intervention, the next step is to take the evidence building and implementation process through one or more of the next 4 phases of the framework, which are contained in this inner loop. The circular nature of the inner loop is intended to alert you to the fact that while the process of building evidence in child welfare sounds very orderly and linear, really in everyday practice there's lots of jumping around and nonlinear thinking. And that should be both expected and encouraged. I'll leave you with a story that came to me recently in a discussion with a staff person who's working to try to find homes for children in long-term foster care. She told me about one of the most difficult cases she's working with, a 15-year-old boy with a criminal record. He's been in care for a long time, from a young age, and all he wants is a family that will love him forever. He asks her on a daily basis why she hasn't found a home for him. And this is the request that keeps her up at night. He's a tough kid, but he turns to mush when talking about this. She said that what allows her to sleep at night is the knowledge that she's not just doing what feels right. She's implementing a program that is supported by research, and she knows that if she continues to follow the program, she will find him a home. And now I'm going to pass it back to Melinda.
Thanks, Nancy. We're going to switch gears a little bit and talk about the Continuum framework for about the next 20 minutes. This framework provides structure in our work with the partner sites and also a framework for how we view post-permanency services. So listed on the side in the slide, you'll see the Continuum framework. I want to explain a few things about this framework before we begin talking about each of the intervals that are listed up here. First, I want to bring your attention to three colors that are listed on the framework: blue, green, and gray. The green represent intervals that take place after finalization on the post-permanent side. The blue represent intervals that take place prior to finalization on the pre-permanent side. And the gray areas represent those areas in the continuum that we believe are very critical to this overall continuum, but they are not going to be areas that we are going to be working to implement valuable interventions with our partner sites. Jointly, though, we believe that all of these boxes, which we call intervals, make up a continuum. Looking at the continuum, there are two fundamental concepts of the framework that emerge. One, the idea that preparation for adoption and guardianship, if done well, starts at entry and continues throughout the entire continuum. And secondly, that post-permanency services should not be seen as a bucket or one type of program, but instead an array of services that range from low intensity, universal, all the way to very high intensity types of interventions such as intensive. I'm now going to briefly summarize each of the intervals that were listed on that continuum. Stage setting includes all children in care. It involves setting the stage really from the very beginning when children enter the child welfare system. It recognizes the need to have a solid plan in place if return home can't be achieved. It also recognizes that things we do as a system at the very beginning do have an impact on permanence. There are some service examples that are listed on this slide. Again, I just want to bring your attention to the fact that this is a gray interval, so it's not going to be one that we're going to be working with the sites on to develop or implement a valuable intervention. However, we will be working with them on capacity building in this area. The next interval is preparation. Preparation includes children where reunification has been ruled out and they're on their way moving toward adoption or guardianship. It includes those activities we do to adequately prepare both children and families to move toward adoption and guardianship. These activities also have a big impact on permanence, and they include things such as full disclosure, preparation, addressing trauma and loss, and planning for birth parent involvement after finalization has been achieved. Again, this is a gray interval, so we'll not be implementing valuable interventions with the sites, but we will be working with them on capacity building throughout our initiative. The next interval is focused, and focus really addresses target group 1, which I mentioned back on slide 8, but the population is also defined here on this particular slide. Focus services are really twofold. One, they're designed to meet the needs of children, which may be hindering their attainment of permanence. And secondly, they provide families with the capacity to meet the needs of children and to feel comfortable becoming a permanent resource for them. There are 4 tenets that are listed here on this slide for this interval. I'll briefly go through each of these. The first one is that we want to equip prospective adoptive and guardians with an array of supports and resources. Secondly, we want the intervention to focus on helping families manage the children's mental health, emotional, and behavioral issues. Third, we want to tailor recruitment and matching to the individual needs of the children. And lastly, we want to ensure that there is a solid plan in place for children before they go to finalization that lays out the services and supports that they can expect once they move to adoption or guardianship. There are many examples of this type of intervention. There are 3 that are listed on this slide. I'm going to take just a minute to explain one of these examples. I will mention briefly, and I'll talk about this again at the end of the webinar, that we will be having white papers developed on each of these intervals that will be available in the late fall or early winter. They'll They'll be available on our website for the general public, and they'll go into much more depth about the population, the tenets, as well as examples for each of these intervals. But for focus, for the intervention that I'd like to discuss is the New York Permanent Parents for Teens project. This was a demonstration project that was funded by the Children's Bureau between 2004 and 2008. The goal was to find adoptive parents for teens in congregate care. The program consisted of three main components. The first was intensive recruitment, child-specific intensive recruitment. The second one was preparation for the families. There was a 10-week learning experience for all families to go through that helped them not only learn what they can expect currently, but what they should anticipate in the future as they go through the adoption or guardianship journey. And then lastly, support. There were shadow workers who usually consisted of a very experienced adoptive parent or a former foster youth who were assigned to the families and were there to provide that daily support and emotional help that was needed as they walked through this journey after the child was placed in their home. Listed on this slide are some of the outputs and outcomes that we hope to achieve with focused interventions. And focused interventions is one of the intervals we'll be working with the sites to implement a valuable intervention. I'm now going to move to the post-permanency side of the continuum. The first three intervals that are listed on this slide are all considered to be prevention. They come from a medical model. And as the graphic shows, the number of participants narrows as programs become more intensive. Also, the average risk for discontinuity increases, as does the intensity of the program. I'm now going to walk through and provide an example of universal. This interval includes all children adopted or in guardianship placement. Universal interventions are low intensity and include engagement type of activities. They provide information and support to all families who adopted or obtained guardianship. There are 4 tenets that are listed with universal. The first one is proactive. Universal is very proactive. It can be newsletters, it can be surveys, it can be check-ins, things that are done for all the children and families that adopted or obtained guardianship, and it's done long before there's any type of problem on the horizon. Secondly, as I mentioned, it does include all children and families, and it's really maintaining ongoing connections. So making sure that there's consistent touch points with families throughout their post-adoption or guardianship experience. Third, it's a constant reminder of service and support. So constantly letting families know of where they can access services, what supports are available to them, and how they go about doing that. And lastly, it also provides access to educational opportunities, ensuring that families have the opportunities to increase their knowledge and capacity in their role as adoptive or guardianship family. On this next slide, you will see 4 examples of universal interventions. On the far left, we have a survey that was conducted in Illinois. On the far left on the bottom is the Tennessee Foster Parent College, which is available for both foster and adoptive parents. On the top, you'll see the New Jersey ART program. And then on the bottom, you'll see the Wisconsin Home to Stay. I'm going to provide a few details about the Home to Stay project in Wisconsin. This is a project of the Coalition for Children, Youth, and Families and Jockey Bean Family. It connects adoptive families with a post-adoption specialist who will visit their home after finalization with a personalized backpack along with gifts for the child and family. These gifts include resources to assist with the next phase of the adoption journey and how to access services and supports through their PARC program, which is their post-adoption resource center. Again, this particular intervention is offered to all the families. Listed on this slide are the outputs of the outcomes that we hope to achieve with universal intervention. I'm now going to move to selective interval. Selective interventions target children and families who have characteristics that research suggests may put them at higher risk for discontinuity. This is based on factors that are known at the time of finalization. It does not mean that the child or the family has demonstrated any problematic behavior. It's important to note that the goal of these interventions is to increase protective factors to reduce the risk for discontinuity. Listed on this slide are 4 main tenets of this particular interval. The first one is to target risk factors known at the time of finalization. Certainly there's a lot known in regards to risk factors for both children and families. An example could be the age of the caregiver, or another example could be the number of placements a child has before moving to finalization. Secondly, you want to provide increased support to these groups through information, services, and support. Third, you want to ensure that these interventions are in place before behavior actually manifests. And then lastly, you're using data and research to target families. We were not able to find a lot of interventions that fit in this particular interval, but there are 2 that are listed on this slide, and I'm going to provide a little bit of information about the one in Vermont. Vermont looked at data of 106 post-adoption cases where the child was not currently living in the home. They wanted to try to identify commonalities among these cases. They found that, not too surprising, children between the ages of 11 to 16 had increased issues, and it tended to be a trying time for the families. One intervention that they decided to institute based on this was a letter that goes out to all adoptive families prior to a child's 16th birthday. They ask basic questions such as, do they want to be connected to post-permanency services? Is the child still living in the home, etc.? It's a way of checking in with the families that they have targeted as being at risk so that they can ensure they connect them with services. The outputs and outcomes that we hope to achieve with this particular interval are listed on the slide. The next interval is indicated, and the key difference between selective and indicated is that families and children are now actually experiencing some type of issues. Families may reach out to the system for help, so they may make a call for one thing and it ends up that as you talk to them, there's many more issues that are there. Or we may identify families based on some type of outreach that we do as a system. This interval does not include full-blown crisis, but instead works with or targets children and families who need assistance to maintain stability. There are 5 tenets associated with this particular interval. Number 1, of course, is that it happens prior to crisis. Number 2, its aim is to reduce tensions and promote stability. Number 3 is it has to be an intervention that involves more than just information and referrals. At this point, families are not just looking for a phone number to call or a resource that they could access. They're going to need something a little bit more intensive than that. Number 4, the interventions address characteristics associated with an elevated risk of discontinuity. And lastly, they not only work to stabilize the family, but they also assess for ongoing service needs and ensure that those are met. There are 3 examples of indicated interventions that are listed on the slide. I'll take a few minutes to talk about ADOPT, A-D-O-P-T-S, the stress of post-traumatic stress. It's a hard one to say. ADOPT is a structured therapeutic intervention to help trauma-exposed children. It was developed by Bethany Christian Services to address the distress of post-traumatic stress. It includes individual and family therapy as well as groups for parents and children. It uses the Attachment Resiliency Competence Framework, or ARC, for its overall framework. The outputs or outcomes that we hope to achieve with indicated interval are listed on this slide. The next interval is intensive. This particular interval focuses on children and families who are experiencing a crisis that threatens the stability of their placement. In these situations, the child may or may not be living in the home at the current time. These interventions provide immediate support and aim to reduce the risk of dissolution. These interventions are primarily high-intense programs that involve high cost and high staffing ratios. The tenets associated with intensive services are listed on this slide, and I'll summarize them. They look at strengthening social connections and relationships. They focus on the whole family system and how to provide stability to that family. And they increase the caregiver capacity and confidence with the aim or the goal to stabilize the entire family unit. There are 4 examples of interventions, each providing a slightly different aspect to this particular interval. I'll provide some information on the Mobile Urgent Treatment Team for foster families. This particular intervention takes place in Milwaukee. Although it primarily focuses on the foster care population, it is a program that could be applied to the adoption population. This particular program offers 24 hours assistance, 7 days a week for families facing a crisis. The program provides emergency services by phone, in-person contact to stabilize the crisis situation, the development of a 30-day service plan, and 30 days of support from trained staff for the families and children. The outputs and outcomes that we are hoping to achieve with this type of interval or interventions are listed on the slide. And then we move into our last interval on the continuum. And again, this is a gray interval, so we are not looking to implement an evaluable intervention in our pilot site, but we recognize the importance of this particular interval. I like to explain this one similar to when you go to a dentist's office. When you usually go to see a dentist and you have some kind of a procedure done that's intensive, like a root canal or something like that, most often, or I should say the good dentist offices, will follow up the next day to see how you're doing, to check on the medications, to check on the pain, and to see if there's been any further complications so that they can get in there and help out before it becomes a crisis situation. Similarly, in child welfare, we want to ensure that the gains from intensive and indicated intervals are maintained and that the skills that families learn during that time are able to be applied as they move along. So in essence, we want to ensure that families learn and prevent those types of triggers from taking place that might, again, cause a crisis to take place with the family unit. So I'm now going to turn it to John, who's going to talk about not only how this continuum can be applied at the site, but also to share how Tennessee's continuum looks when you apply this type of framework to their service array. John?
Thank you, Melinda, and I appreciate everybody's time and hope you find this discussion is helpful to you. Before getting started, I just want to acknowledge the other members of our QIC-AG team here in Tennessee. Ms. Erica Conwell works here in our office and is serving as site implementation manager, but we're also partnered with our post-adoption services provider, Harmony Family Center here in Tennessee, and we have Nicole Conning and Pam Wolf representing that agency as co-site implementation managers. And then we're also getting some wonderful support from our IT and SACWIS division from Frank Nix and Stuart Clements, who are critical to us in really assessing our continuum of services and what we do to provide this type of support to our adoption and guardianship families. So we couldn't be making the strides we are without, of course, the collaboration of the team. But I want to first kind of explain to you how we moved into the use of the continuum framework. Before getting here, and you may have caught on through the presentations of Nancy and Melinda, we spent a lot of time engaged in first identifying which was the target population we wanted to focus on, pre or post-permanency. And of course we chose post-permanency. And then we spent a significant amount of time doing a population template that forced us to assess and ask some questions around what does the population look like, what types of services are they already getting through post-adoption support in our state, how many children and families are receiving adoption assistance subsidies. So we were trying to set a platform of this is what our clients look like, here's how many they are. And we also mentioned in that population template a survey we did of adoption and guardianship families last year that gave us some great feedback around what they felt like they needed. So there was some, I guess my point here is that there was a lot of groundwork laid before getting to use the framework, because once we completed the population template, we also did a continuum assessment that assessed our entire continuum as it was described throughout the presentation. So we looked at a macro and a micro level at each interval. So if you think, so if we want to talk about what the continuum framework is, it was a set of, it was designed by the QIC-AG professional consortium and the members of that team, and it asked us to look at and assess the 8 different intervals, and the exercise included documenting all of the supports and services in each agency's unique service array at the individual interval, and to identify streaks and areas for improvement as well as gaps. So as we progressed, if you think about it, we did the population template, we did the continuum assessment, and now we're applying all those things we've learned into the continuum framework itself. So if you think about it, and I just want to refresh your mind with what the continuum exactly is, and Melinda did a great job of describing all of the 8 intervals, and we chose here in our state to focus more on the intensive level. So that is at the far right end of the continuum there, prior to maintenance. And I'm going to bring you back to slide 65, which kind of gives you a better description of exactly what the intensive service is designed to do and the population it's targeted for. So we're talking about children and families in crisis and may or may not be in the home, but there's a need for immediate response to them. So that description itself was somewhat of a driver into what our focus itself was going to be. So you may be asking, why did Tennessee choose to look at the intensive interval? So just to let you know, we made our choice based on the feedback we received from our post-adoption and guardianship families and the survey we completed with them. Particularly in that survey, we learned that families, many of them, are still unaware of the opportunity for post-adoption support or even how to access the service. The post-adoption program we have available through our agency has been in place for almost 11 years now. And, just when you feel like, wow, everybody must know this is out there, we got some sobering information that still a little bit less than half the families, as much as we had tried to communicate it, placed it into their adoption assistance agreements, provided other information and materials in our local offices, they didn't even know it was there. So that was something we needed to respond to. We also chose this interval because of the relationship we got with our post-adoption service provider. We're very confident in the services that are provided to families once they get to the provider. On the data that we have from Harmony that regularly reflects to us that, once families get to Harmony, less than 2% of those families decide to dissolve their adoption or enter into discontinuity. So we know that if we can just get them there, we've got a high likelihood that families are going to remain intact. So based on that, we felt like we had to have them to the table in this project. And then lastly, this was one of our main drivers, is we felt like there's a significant number of kids that are at risk or experiencing post-adoptive discontinuity that we believe have been exposed to significant traumas, and specifically sex abuse that go untreated while in care. And we don't want to say that it's ignored. I mean, a lot of times these kids don't disclose till after they've been adopted, or the behaviors don't manifest till adolescence or later in life until they become sexually questioning. So we're still doing some research on exactly what kind of issue this is for us, but these are regular stories we hear. And if we look back at some of our children that are re-entered and now awaiting a second adoptive placement, this population can encompass several of those children. So once we decided on the interval and of course the population, the target population we're going to be focusing on, we applied what we learned through our continuum assessment to the framework itself. So what we did, if you see this slide here, we set each of those intervals on a grid and headed them at the top by the interval type, and started dropping in there in columns beneath what are the services that we have in place that fall within that particular or unique interval. So for example, for preparation here in Tennessee, we have an assessment that helps address that. We have our case practice at some level prepares families. We also have an educational program through our Adoption Support and Preservation Program where we can provide training to families, pre-adopt and prepare them better. Lifebook, of course. So we took the framework and started dropping our existing service array under each unique interval so that we got a full picture across that continuum of exactly what was available to families. And what's not presented here today is not only did we identify the service itself, but we also created another document that gives a description of the service. So we dove in a little bit further than what's presented here in the grid so that we have some additional narrative information that describes each unique intervention itself. So this slide here indicates the other 5 different interval levels, so I won't spend a lot of time going each into what Tennessee has available in each of those areas, but the purpose here is really to show you the exercise of how we dropped each of the existing array pieces into the framework. So, of course, as you can imagine, this took some time and some energy to do, and several different conversations. To really be successful at this, if anyone's interested in moving ahead and assessing your own agency, you really need to think about who are the right people and stakeholders to get to the table. Over a course of about 3 to 4 different extensive conversations, we really began discussing and gathering the information. So there's a lot of benefit to making this type of investment. Some of the benefits include it creates a better understanding of all the service and supports available to clients across the continuum, of course, but it can also establish new partnerships with new community stakeholders and clients. It'll also help you to engage others to discuss and assess really what's the health of the continuum as it relates to adoption and guardianship exits. It'll force you to seek out and use data, both qualitative and quantitative, as it's related to existing services, and to discern how well current programs and treatment modalities are working for clients. It'll stimulate you to think about how to improve practice across the service array and fill gaps with evidence-based and perhaps even behavioral interventions. Melinda spent some time earlier talking about just changing the way we act can sometimes produce as much of a positive outcome as the investment of implementing an evidence-based practice. So it may be something just as easy as sending a letter out to families to remind them or to prompt them to take an action. And then lastly, one of the benefits is it creates next steps of engaging in a root cause analysis before moving to a solution. But I also didn't want to miss the opportunity here to share with you what we experience as far as challenges go. And to just let you know the benefits do far outweigh the challenges. Of course, the existing culprits are there, how much time, complacency, competing priorities, but you really need to make this a priority for yourself if you're going to invest the time and energy and engage the right people to complete the framework. So it does include getting the right people to the table to identify the services and the description and to do the health assessment I spoke of. And then, of course, lastly, prioritizing system improvements and enhancements that are identified from the analysis. So it's really, once we've engaged in this set of work, how are we going to use it? Because if you're anything like me, if you're going to invest that time and energy, you need to be able to close the loop on it. So I mentioned in the previous slide, but I want to go a little bit further here around, once you've engaged in dropping your service array into the framework, so what's the next step from there? And our next step was to go through a root cause analysis, and we're still in the midst of completing this step right now, but I wanted to give you an example of what that looked like. We created several different problem statements, and this is just one of them, to drill a little bit deeper around what's going on with this issue at this intensive interval in our state. So the question or the problem statement is there are post-permanency children in crisis that are at risk of discontinuity? And so we ask ourselves, why are children and families in crisis? And the response is because families can't manage the behaviors in children and children can't self-regulate. So why can't they self-regulate or manage the behavior? It's because they don't have the skills and or have not been provided the supports to manage their behavior or self-regulate. Well, why don't children and families have these skills, or why haven't they been provided the supports to manage the behaviors and to self-regulate? It's because they haven't been exposed to the correct supports or programs that address developmentally appropriate responses to unresolved adoption and trauma, specifically sex abuse issues. The key point here in this question is the correct supports. As we have existing ACEP services available to families in Tennessee, there's a lot about that service that works. But for some reason, for this issue and around these children that have experienced sexual abuse, it doesn't seem to be the correct support for them. So we're trying to ask ourselves, what else do we need to be putting in our toolbox? So the next question is, why have they not been exposed to the correct support or program that addresses developmentally appropriate responses to unresolved adoption and trauma? It's because the right approach has not been selected. So it's around what we're finding out, or through the initial analysis, is we're going to be needing to expand our toolbox, not necessarily throw the baby out with the bathwater, because there's a lot about what exists that works, but we need to be putting more tools there. And then the last question in this part of our analysis is, well, why haven't the right treatment approaches been selected? And it's because there's not a comprehensive assessment process that identifies the most appropriate intervention to address unresolved adoption and trauma issues. So as you can see through the exercise, we've drilled all the way down to and potentially identified our cause as a skill development issue for our ASAP clinicians, as well as broadening the assessment tools to better identify it. And this is just one potential source of our issue. As I shared earlier, we're asking this question several different times in different ways to make sure we're getting down to the right effort. Our next step, once completing the root cause analysis, of course, is to develop our theory of change. So from there, we'll be identifying how we want to modify and change our system, and then working towards identifying potential practice issues, interventions to address whatever that root or cause is that will hopefully get us to the change we need. So as we wrap things up a little bit, I want to share with you how you might be able to use this yourself. So think about using it as a system learning tool and to facilitate team exploration and learning around the existing service array. It's a real cost-effective way to get an honest picture of pre- and post-permanency services available to clients. So if you're wondering where your continuum sits, I would encourage anybody to take the time to go through the exercise. It also allows the agency or the user to assess the entire permanency continuum of adoption and guardianship, or just specific intervals. So if you wanted to just drill down further into your maintenance area, you could of course do that. It may not be as much a time or energy commitment. Then lastly, supports further analysis of unique intervals, and even individual service providers should understand their outcomes. and the solutions can range, including implementation of a new behavioral or an evidence-based intervention. So you can go as far as you want to with this, or you can really focus on how do we need to modify or change our existing policy and practice. So I want to encourage you, there's a polling question here I'm going to ask all of you to complete around looking back and asking you to take a look and poll yourself on your personal assessment of your agency's framework. And before you do that, let me explain the ratings there in the poll. Very weak, it means there's missing many services and supports. Weak is missing many services and supports, but we're developing plans to address the needs and fill the gaps. Emerging is some services and supports are still missing, but new programs and services are in the development phase and will be rolled out soon. Sufficient, it means families have access to a basic continuum of uncoordinated post-adoption and guardianship services. And then lastly, proficient or excelling, families have access to a complete continuum of services, and when provided across systems are coordinated and proactively provided, very strong and robust. So if you think about those descriptions as you answer the polling question, hopefully you'll be able to give us a reflection of where your agency's framework exists now. So here's the poll. I'll give you a minute or two to respond to the question, and then I'm going to be turning it over to Ingrid to facilitate our next area of the webinar.
Really quick, as people answer this poll, this is on the pre-permanent side of the continuum. So these are for those services and interventions that happen prior to finalization that are there to really promote the movement toward and preparation for adoption and guardianship. I'll give people just one more, well, I was going to say a minute, but that's probably too long. I'll give you a couple more seconds to answer this, and then we'll move. There's one other poll question we want to ask before we get to the questions. So you can see them up on the slide. Emerging seems to be the largest percentage right now, followed by sufficient. I'm going to move on to the next question. This question is pretty much the same. I won't go through the definitions as John did because they are the same, but this one is specific to your post-permanent side. So for those services and interventions that you have for children and families after they achieve either adoption or guardianship, if you could take a few minutes, a minute to fill out this particular poll, and we will show the results as well as we go through this. Okay, so it looks like about 35.6% listed them as weak, and then emerging is moving ahead, now at 27%. So I don't think this is surprising probably for anybody on the phone, because certainly the focus I think of most child welfare systems has been on the pre-permanent side, and we're just now starting to focus more on this post side. So thank you for completing those polls. I'm now going to turn it over to Ingrid to open it up for questions.
Okay, everybody. This is the question and answer portion of our presentation. And as a reminder, you can join the conversation by phone by calling 1-866-325-7968 and entering the passcode 206-80753. You can also submit questions or comments by typing in the chat window, which is located at the left of your screen. And if typing, just click on the send button to submit your questions. Please remember, when you're not actively participating, press *6 to mute your line, and you may also use *6 to unmute your line. And please don't place your phone on hold so we can avoid any hold music or other interruptions during our meeting. And Tammy, please unmute the line.
All lines are open.
All lines are open. Happy to take the call.
We've opened all lines just to remind people so that if, in the event you're not on mute yourself, we're now hearing your conversation. Any questions?
Okay, I was asked to repeat the email address. If you want a copy of the handout, just email me, Ingrid Parks. My email address is IPARKS, Ingrid Parks, iParks at Spalding, SPAULDING.org, iParks at Spalding.org.
All right. Well, we'll then go to the last part of our webinar. If you do come up with questions, Tammy, if you can mute those lines again as we close out this webinar. But certainly if you do have questions that come up, feel free to email us. I'll direct you to our website in a few minutes where you can obtain our email addresses and send us personal questions if you have them. We're drawing near to the end of this particular webinar. We really appreciate you spending the hour and a half with us to go over this information. But before we close out, I want to provide a few of the resources that the QIC-AG will be releasing in the near future. The first one I mentioned earlier, but we will be having white papers that will provide more information on the population and tenets, examples, outputs, and outcomes for each of the intervals that I reviewed earlier today on this webinar. We expect those to come out in late fall or early winter. The second thing is a web-based catalog of interventions. This catalog includes interventions and programs that range from effective and proven by research to more promising practices. It also includes a scale on how these interventions or programs are relevant to the adoption guardianship population. And it's a web-based catalog that people can easily access that will then connect them to the other types of database systems that exist with interventions to obtain additional information. And then lastly, we plan to have ongoing webinars throughout our next 4 years. Based on that, we will be providing periodic alerts when products are released or webinars are being offered by the QIC-AG. If you would like to be added to the distribution list, please just click yes on this particular poll that's up on the slides right now, and we'll automatically be able to capture your email and put you on that list to ensure that we notify you when there is something that comes out. And I know that people get many emails. We will not be sending them regularly, so have no fear. We're not going to bomb your email boxes. A survey will come up once you sign off from this particular webinar. I encourage you to please take a few minutes to complete the survey. We will also send out a link to the survey in a couple of days for those who did not get the opportunity to complete it today. We truly value your input, and we'd like to hear back from you. Lastly, I have the website up there for the QIC-AG. You can access more information here. Again, as Ingrid pointed out earlier in the webinar, we will be having a recorded version of this particular webinar that will be available on our website. We anticipate it going up in approximately 1 week. If you have any questions or would like some additional information, please reach out to myself or Nancy or Ingrid at the conclusion of this webinar. And for that, I'm going to go ahead and conclude our webinar, and I thank all of you for participating with us today. Thank you so much.